typically gingivitis, especially periodontitis, and thus also peri-implantitis, all of which are very common forms of dental or oral disease, are in themselves a high cardiovascular risk when considered on their own. But in menopause, a few more aggravating factors multiply and come into play, because you see, before menopause, women generally have a lower cardiovascular risk than men. After menopause, however, this risk increases negatively, meaning women then become just as susceptible to cardiovascular risks as men. The mechanisms are as follows, and they are fueled by this hormonal change, a deterioration of endothelial function. Now, good endothelial function is an important risk avoidance factor for any cardiovascular plaques and corresponding cardiovascular events like stroke, heart attack, and so on. And this also happens through a change in lipid metabolism. In menopause, or from menopause onwards, there tends to be an increase in LDL, especially oxidized LDL, which is again negative. There is a drop in HDL, so both are parameters that in themselves are negative. And above all, there is an increase in visceral fat storage, so the fat distribution becomes more visceral. And that is in itself a high risk factor in both men and women for many systemic diseases. So many negative things come together here, and insulin resistance also worsens